I would also like to share how and why one of the reasons of choosing cardiovascular surgery after doing general surgery was I wanted to do something more finer. I was not okay with the 2O, 3O, prolines, anithalons, and vicryls, the big needles. I kind of was desiring to have a skill set which is more finer needle, a 5O, a 7O, a 8O, 9O proline, a hair like suture, and developing that dexterity. And that was one of the reasons, a main reason to super specialize into cardiovascular surgery. All said and done, I really don't want my listeners, my juniors, to just go bluntly into something that they like. See, there is a difference between like and passion. Passion is something where you don't have an option. When people ask me whether should I take cardiac surgery or neurosurgery, it is not passion. It is some sort of liking. You are interested. Passion is when there is no option. And if that is the case, you will eventually do it. Why am I trying to highlight on this point of liking and passion? Is because of the third parameter which is important in choosing the right branch, is assessing your financial goals and current financial situations. At this point of time, doing what is required is more important than doing what you like. So here comes the thing of like and passion. If it is passion, you are bound to do it. But if it is about liking and interests, you keep that step back from doing what is required. If you are from a tier 2, tier 3 city, there is no good general surgeon. There are a hell lot of physicians and other paramedicals who are practicing medicine. It is wise to take up general surgery. If at all it is contraindicated for you, that's a different ball game then. But it's wiser to do something that is required. So something that is more important than your personal liking and interests is your financial goal. The current demand of financial stability for yourself, for your family, and for your future, and the clarity of your life goals. What do you want from this life? And choosing a branch which will help you, which will act as a tool to achieve that particular goal in your life or that particular vision of your life. So I will try to make a more elaborate video later on this point, but I just want to highlight that qualifications are only a tool for a medico to achieve his vision of life. Qualifications are not the goal of life. I am worried and I get a little disturbed when I see this being a reflex norm amongst the medical fraternity, that कि भाई आगे क्या करने वाले हो, what are you going to do next? And then he comes up with DM cardio, he comes up with some fellowship, he comes up with something like practicing his branch. Your identity should not be limited to being that qualification. Life is beyond that. Life is much more than that. So here I would like to share one sensible and cute example of one of my friends, my juniors, who was a very, very, very dear friend of mine. He's still now my good friend. He was the one who kind of propelled me into taking up general surgery after my internship. At times when I was a little doubtful whether to go with general surgery, because a lot of people trying and telling about the scope of general surgery, the long curve of it and all. He was the one who always wanted to be a general surgeon. Throughout his MBBS times, we used to talk and share about surgery things, and he used to push me, and he actually pushed me and propelled me at times when I lost hope of taking up general surgery. This guy, when he cracked the exam after his internships. Um, he took up general medicine and after a couple of months, a year or so, I realized that that was a very wise and sensible choice given his financial condition, situation, and his social obligations towards his family and his people and community around. His village, his town didn't have a good physician, and surgeon would definitely take a longer time to earn with a little more investment of time and energy, and that was not affordable to him. He was a good guy. He loved surgery, but he was sensible enough to make that wise choice of being a physician. His brother was not much educated. He had planned to open up a pharmacy for him, and then he will look after the pharmacy, and his cousins who are kind of unemployed will be doing the management of the hospital in and around PR and all. So that was a good plan, and that plan was based upon his current social liabilities, his current financial status, and his aspiration of financial goals. That brings me to the fourth and probably now the most important aspect, the most important parameter in choosing the right branch for you, and that is your geography of practice. I say you are lucky if you know down the line after this post graduation or after your super specialty which place are you going to settle in. What is your geography of eventual practice? If that is sure, you will have a smoother course of making right choices in this journey. If you are sure that I am going to be in Bombay, Chennai, Bangalore, Delhi, a tier 1 city, or even now a tier 2 city which has good infrastructure, which has good super specialities, who have already started to gain a good upsurge of medicos getting into different variety of fields, then you definitely have to do something which will give you, which will carve a niche for you. So super specialty kind of becomes mandatory. Super specialty in the sense any kind of fellowship after your post graduation, any kind of postgraduate diploma or super specialty, whatever, just to carve out a niche compared to your contenders. And if it is tier 2, tier 3 city, you have to just see what is required in that city. You have to have your own data, your statistics, talk to the senior physicians, senior surgeons in the town, village, and just see what is required and do that. That will give you the desired amount of respect. If you give that quality of care, you will be not an option, which is usually in the tier 1, tier 2 cities. You are one of the 100 options. But if you are one of the 3 or 4 options, or if you are the only one, you'll be respected more, you'll be wanted more, you'll be the coveted medical professional, you'll be paid better. I assume you'll be satisfied more. Yeah, you'll be exhausted, but you'll have the choice of how much to work and when to work and how to work. So just to summarize this whole approach about choosing the right branch, first is knowing the branch well, second is knowing yourself well, third is assessing your financial goals, and fourth is your geography of practice. So that was my bit on choosing the right branch for post graduation. Do let me know in the comment section if you have liked this video. If you want any further topics to be discussed and shared, I'd be really happy to do that. Please like, share and subscribe. Thank you.